My name is Ryan, and I'm a firefighter paramedic.
Again, my name is John-Luc. I'm an emergency room nurse. I've been an emergency room nurse for 8 years. I work most of that time in Baltimore, a hospital called Midtown Campus. Now I'm at a hospital in Glen Burnie called Baltimore Washington Medical Center.
Hey Mosaic, my name's Sean Peffel. I work with Mercy Hospital doing internal medicine. And we go into medicine because we love treating patients and fighting disease, finding problems, and it's times like these that we realize that what we do for a living can not just affect us, but affect our families.
One of the things that myself and my coworkers are constantly faced with through this pandemic that we're all experiencing is kind of the uncertainty of the patients that we interact with on a daily basis, and if they are or not infected, and kind of working through that.
This pandemic is a real deal. The biggest fear for us is getting our families sick. That's the thing that we're stressing out a lot about.
I'm Matt McCrassick. I've been going to Mosaic for 3 years. I serve on the security team, and I am a firefighter paramedic for the DC Fire Department.
My name is Kish Kavunag. My family and I have been attending Mosaic for about 7 years. Behind me is the University of Maryland Medical Center downtown campus, where I work as an infection prevention nurse.
I want to give a little insight on what it's like to be on the front lines of this COVID-19 pandemic. So for us here in the fire department, we are the ones when 911 is called. We show up and we're putting ourselves into a potentially contagious environment at someone's private home, their vehicle, a hotel room, or their self-quarantine. As far as prayers for our department, we've had a number of members that have gone off sick and are currently in quarantine. I would ask just for continued prayers for them. We also have members that are immunocompromised, that are struggling with coming to work because of this pandemic. We also have members with family members who are sick. So if you could just pray that our members would remain healthy, that our members would come back healthy, and that we would be protected from bringing this sickness back to family members. I love you guys, and I thank you for the prayers you're bringing forth.
On a regular basis, we're exposed to things and don't really think too much about it because that's just what we do. But it's times like these that we realize that being on the front line and exposed to things is not really just a risk that we're taking, it's a risk that our family takes too. So when you're thinking about people like the doctors or nurses or medical assistants or firemen, policemen, people on the front line, don't just pray for them, but pray for their families.
Pray for us that we would know that God is with us. If God is with me, then for lack of a better term, it'll be okay.
So if there's anything that we could definitely use prayer for, I think it'd be two things. The first one being, just wisdom in these situations on how to handle things. Really just for the patients to know that, they have people that care for them and that are trying to look out for them and do the best for them.
Please pray for our team. Please pray for peace of mind and endurance. We have already been working long hours for weeks, preparing and planning. We are mentally and physically tired, but we are persevering. Please pray for the healthcare workers in the hospital. They are the ones who are truly in the front lines. Please pray for strength and endurance and courage as they get through their 12-hour shift, anxious over the possibility of being exposed and bringing the virus home to their families. I know you've heard this numerous times before, but please heed the stay-at-home order. Only go out when absolutely necessary. Do not go out if you're sick. Practice social distancing. Wash your hands frequently. These measures mitigate the spread of COVID, and it helps the already overwhelmed healthcare system not get flooded with treating patients with COVID or those who don't have COVID. Thank you very much, and God bless.